Hi, everyone. This is Tim Wagon with the Avalon Foundation. We are back with our final edition of COVID Answers with Choptank Community Health and the Chief Clinical Physician from Choptank Community Health, Megan Waco. Megan, thank you, first of all, for doing this with us for the last month to help Talbot County and the Delmarva. This was our last edition, and we wanted to go over a couple, maybe sort of sum up what we've figured out over the process. And I know the first thing you wanted to mention was to get up to date with vaccines. And what did you want to say about that, about the vaccines?
Right. Thanks, Tim. Just thinking on like the top 5 take-home messages, there's tons, but first and foremost, just get up to date with COVID vaccinations. And that can mean a lot of different things for different people. If you got one and you never went back to get the second, please go get it. If you got 2 and you are eligible for your booster, it's been 5 months, go ahead and get it. If you got the Johnson & Johnson and it's been, more than 2 months and you're eligible for that second one, go get it. Just because we know that those boosters are really important at decreasing the hospitalizations and deaths. And then especially with kids, if your kid is 12 and up and they're going to be eligible for that booster after 5 months, don't wait. There's no reason.
And real quick, Megan, if I could ask, what excuse are people saying for not getting the second or third? Is it just that you're hearing? Is it just, well, I didn't have time, or I thought it was okay, or what kind of thing? What do you hear when they say that, or when they say you only have one?
I think there's a couple of reasons that I hear a lot. One is if they had some kind of negative side effects with the first one and they're, just kind of fearful of what that would be for the second one. It doesn't necessarily mean that it's going to be worse the second time or anything, and it's just a day or two and then you're kind of back to it. So definitely not a reason. And then the other one I hear a lot is if they got their first one and then they had an infection with COVID and they think maybe they don't need that the second or the rest of it, and we know that you do, and that it is significant improvement with the severe disease. So that's not a reason either.
Right. Okay. And then I think you wanted to go on to, this is really interesting to me actually too, is the importance of the well-fitted mask.
Right. So now, when we talk about masks now, it's not just masks, it's a well-fitted mask. And the reason is because we know with cloth masks that they aren't as effective at stopping the spread with Omicron. And so, surgical masks are better. Double masking with a surgical mask and cloth mask is even better. And then if you can wear and tolerate those KN95s or N95s, those give us the best protection.
Megan, we see this in other countries. Do you think masks are here to stay? For some people, probably?
I do think so. It's you can almost look at it as a courtesy or respect if you're symptomatic and walking around to go ahead and wear that mask.
Okay. And the next thing, Megan, we wanted to go to was how to use the rapid test or at-home tests again, just to remind everybody about that.
Right. Those home rapid tests, they're great. You just have to know how to use them. If you are symptomatic and you take it on that first day and it's negative, you still want to wear that well-fitted mask and kind of in the back of your mind know that it might be just too early to get a positive result. And then you want to take another one, a day or two later to make sure, or get that PCR to really know. If it's positive, then be confident that, yes, it is COVID. You need to take all those precautions, stay home and stay away from others. And then if you're exposed, 5 days after that exposure, if you can get your hands on those PCR ones, and you're not symptomatic, that's best. But a rapid, is a good indicator too. But again, you want to repeat it another 24, 48 hours later.
Right. And Megan, this is how much more as we start to move away from Omicron and things may end up back to normal, how much data are we collecting over the course of this whole process? And we're going to get more information about this as we continue to, even though the virus may sort of die down. Is that correct?
Oh, yes. Tons and tons of information. And, when you think about just how fast in the volume, it's going to be really interesting to look back and see what we learn.
But what we know is that boosters and masks and hand hygiene work. And I know you want to talk about that a little bit.
Right. So yes, those boosters, well-fitted masks, and hand hygiene works. I know hand hygiene doesn't get as much attention, but there is some kind of early data coming out showing that Omicron might stay on surfaces and live on surfaces a little bit longer than Delta, which might partly explain why part of the spread increasing everywhere. So, if we want schools and businesses and hospitals to function well, we all have to do our part. And if we just do those three things to slow the spread, it'll help.
Okay. And then we have a lot of tools now. Is that right, Megan? In terms of, we're getting more prepared as to handle this particular virus because of the 2 years that we've gone through. Is that right?
Yeah, and we know that there's, just tons of uncertainty and change, and that's what it feels like, but we also know what to do. And we also don't want to ignore, healthcare needs. So, if you have symptoms, if you have a bad case of COVID, if you have some type of uncontrolled disease like diabetes, high blood pressure, or even, depression, anxiety that's really impacting your life, you don't want to defer care. You want to, talk to your primary care provider so we can get you back on track.
And then I know the one word that's coming out now a lot is, with the way things are going to be moving forward, is risk tolerance. Can you explain what that kind of is? And I think a lot of people know what that is, but how important is that going to be in our lives moving forward?
Sure. And I think we all do it every day and we don't think about it, putting your seatbelt on if it's a sunny day, not today in the winter, but if it's a sunny summer day, you have to figure out if you want long sleeves, if you want a hat, if you want sunscreen. So, there are things that we do every day to decide what our own individual risk tolerance is. And COVID is the same. You have to look at who are you around, whether they're vaccinated, if they're immunocompromised. You have to look at, your history with COVID, your vaccination history. And then you have to decide on your own individual, do I feel comfortable being fully vaccinated, having my booster, wearing my well-fitted mask, going to an indoor place with a lot of people? And some people will and some people won't. But we can all do that on a day-to-day basis and try to get back to, doing some things that we enjoy.
Megan Wicca, we really want to thank you, the Chief medical clinician at Choptank Community Health. We want to thank you and Choptank Community Health for doing this with us. The idea was to try and bring the information that the nation is receiving and sort of tailor make it for our community here. And we really appreciate you guys stepping up to work with us on that idea. And we look forward to what's going to happen in the future. The next project we do with you guys, it's a great organization. And I think a lot of people know that, and we really, really appreciate what you guys have done. Do you have any final words?
No, I just want to thank you, Tim. Thank you to the Avalon Foundation for making this happen. It's been great.
And don't forget Jess Bellis too. We want to thank Jess.
Thanks, Jeff.
Thank you, Megan. We'll see you around town.
All right. Bye.
Thanks.